Hi there, my name is Dr. Michael Laidlaw. I'm an endocrinologist specializing in gland and hormone disorders. Happy to be able to speak, fortunately, for Detransitioners Day. Thanks for asking me. Over the years, I've met a number of detransitioners and they've shared their stories with me. Some have become my friends. My heart goes out to them for what they've been through. So many have been harmed by the medical industry. But there is hope, and many have gone on to happy, successful, and fulfilling lives. More and more are coming out to discuss their stories, and they are to be highly commended. I'm going to give a bit of background about my thoughts on this, then discuss medical concerns of transitioning, but focusing on detransitioning and detransitioners. First, features that apply to both males and females, then looking at females, and then males, and then puberty blockers. So again, the topic is medical concerns for detransitioners. Just a disclaimer, what I'm discussing is not meant to be considered medical advice or advice for therapy. Please consult with your physician before undertaking any diagnostic tests or taking any medications or undergoing any procedures. So start with concerns for both sexes, and what I'm about to say is not an exhaustive list of any of the items, but some food for thought. First, there's questions about the gonads, the male testicles, or in the female ovaries. Have they been surgically removed? If so, then they will likely need hormone replacement. If they haven't been removed, are they functional or not, or partially functional? Testing may need to be done to see if gonads are functioning and if they will recover function. If the gonads are functioning to make hormones, then are appropriate levels being produced of testosterone for the male or estrogen for the female? In terms of reproductive function, males will likely need sperm count. Females, evidence of menstrual cycle and ovulation. Are there possibilities or concerns of long-term fertility loss or damage or recovery or needing special treatments? Bone density loss need to be considered either from puberty blockers or for an extended period of time with low to absent sex hormones. And then treatment of comorbid psychiatric conditions if present, counseling if needed. Moving to concerns specifically for females, have they got low estrogen or progesterone levels? May need hormone replacement therapy temporarily or long-term. Need an assessment of menstrual abnormalities or absence of menses. Is there sexual dysfunction due to hormone damage or surgical, possibly? Concerns such as vaginal atrophy. Is there pelvic floor dysfunction, problems with urinary tract infections? Cardiovascular risk can be increased by high testosterone doses that are given for transing. One would predict they'd need assessment of lipids or cholesterol, potentially glucose metabolism, insulin resistance, looking for prediabetes, and also assess for history of side effects that could have occurred, such as myocardial infarction, meaning heart attack, embolisms or strokes, blood clots, or other types of cardiac damage. Have there been any liver abnormalities, liver changes from high doses of testosterone? Is there erythrocytosis, which is very high red blood cell counts due to high levels of testosterone? Again, an assessment of fertility. Has it been compromised or is it intact? What are future options for the patients? Considerations for after mastectomy. There may be chronic pain, scarring, problems with nipple sensation, inability to breastfeed after mastectomy naturally, and then consideration potentially for breast reconstruction if she's looking for that. There's also the problem with high testosterone causing severe acne. There may be facial growth or other unwanted hair growth, other parts of the body, chest, abdomen, etc. And these can require more extensive means to get rid of them if needed or if wanted. There can also be unwanted changes or deepening of the voice, which may be hard to treat. There's potential that some have suffered psychological side effects of high dose testosterone. This could include mood disorders, anger, irritability, and it's been shown there's been psychosis even in a small percentage of cases of people taking high doses of anabolic steroids, this has a similar parallel. Has there been pelvic surgery? If the patient's looking for reversal, what sort of reversal is possible? Will there be chronic pelvic dysfunction, urethral strictures, scarring of the arm or the legs, chronic pain? There could be a lot of conditions there, which gets fairly in depth and would need, obviously, experienced surgeon. With regard to specific concern for males, do they have low testosterone at this point? May need hormone replacement therapy, either temporarily or long-term. If so, they'll need regular assessment of their red blood cell counts, prostate. This could be difficulties with following the regimen or regular checkups and need to have close follow-up. Assess for history of blood clots, deep vein thrombosis, pulmonary embolism, which these risks are increased with estrogen. They could have had a history of stroke, needs to be assessed for. Gallstones can be a complication of high doses of estrogen. It can also lead to high triglycerides, possible lipid problems. Breast cancer risk has been shown to be increased 46 times for men receiving estrogen, and therefore likely would need mammography screening for if they have gynecomastia. Gynecomastia meaning abnormal breast tissue development. They may need or prefer surgery for this, which is, of course, takes time, expensive. There may be issues with insurance coverage and pain and recovery. And then again, genital surgery, if there has been one, is there a desire for reversal? What's possible there? What's the long-term care like? Again, needing an experienced surgeon. And finally, puberty blocker concerns. Once the blockers are stopped, they'll need to be monitoring for recovery of what we call pituitary gonadal axis, meaning how the pituitary gland interacts with either the ovaries or testicles. What's the recovery time? Could be 6 months, 12 months, 18 months, longer. Could there be possible permanent damage? We don't know enough. I think it's possible. What to do while the pituitary is not functioning? Well, hormone replacement therapy could be of benefit, but it will also stop the normal axis to recover. Hormone replacement therapy could be of benefit again, but will interfere with reproductive function unless more costly medications and procedures are used in some cases. So there needs to be a lot of consideration for that. Depending on which Tanner stage or stage of pubertal development the patient was in when puberty was abnormally blocked, they will likely have immature genitalia. If it was at an early stage, there's the possibility of completing puberty, and should this be done by hormone replacement therapy versus waiting for natural restoration of the pituitary function. And then will there be restoration of normal sexual and reproductive function? That would be the goal. There should be assessment of bone density, given the bone density problems that occur on puberty blockers. Monitoring for future osteoporosis would appear to be advised. And then, of course, psychosocial support for part or all of normal puberty development being missed, and then support through what would likely be a late puberty. Okay, thank you very much. Some concluding thoughts. I've spent a good amount of time thinking about how hormones and surgeries for transition can affect a person's body, and how the detransitioner could be helped by learning about what type of long-term and short-term medical problems they can have and how those can be helped along. I think it's only natural that detransitioners would feel skeptical of the medical society and doctors whom they've been harmed by, but they should realize that there's at least a handful of medical doctors willing to speak out, and I feel there are many more who probably aren't willing to speak out, but would understand these issues and would help the person back to health and wholeness. I hope this video has been of help to you, and wish you all the best. Thank you.